Hi, everyone, and welcome. Welcome to CARF's main event April webinar series. It's on allergens, sunscreen, summer tips, and stress reduction. I'm really pleased to welcome over 160 CARF members who have registered for tonight's webinar. And I'm even more pleased to have our wonderful faculty who are leading tonight's lectures on sunscreen, allergens, and summer tips. First, I'd like to introduce Dr. Henry Lim, Dr. Marianne Senna, and Ms. Marilyn I. Welcome to each of you.
Thank you, Jen.
Thank you.
Thanks, Jean.
You guys are really, truly rock stars for this organization, and thanks. Before we begin, I just have a few reminders that I want to go over. The first is that this webinar is being taped in its entirety, and it will be available to all registrants as soon as we can make it available. It's usually within a couple days, but no longer than a week. So you will receive an email with this taped webinar. Second, this is a live webinar. So right now you have the ability to enter any questions in the chat box. So you'll see it on your screen. All you need to do is simply type in your name and then click the Accept Terms and Privacy button and hit Join. Then you'll be able to put in any questions that you would like to have answered live tonight. As a note, Dr. Lim cannot stay with us the entire night, so he will be presenting his lecture on sunscreens first, and then he'll be answering questions immediately following his lecture. So if you have questions while he's talking, make sure you enter them in the chat box so we can answer them right after he's finished. And then finally, if your computer gets a little glitchy or it seems to be a little wonky in some way, make sure that you hit the refresh button on the side by your browser. That may clear up some of the issues if you are experiencing any of those problems. So now we're going to kick it off with Dr. Henry Lim. Dr. Lim is Senior Vice President for Academic Affairs at the Henry Ford Health System in Detroit, Michigan. Dr. Lim has served as President of the American Academy of Dermatology, the American Board of Dermatology, the American Dermatological Association, the American Society for Photobiology, the International Union of Photobiology, and the National Council on Skin Cancer Preventions. So clearly you can see we have an expert. He has published more than 500 articles, edited 9 textbooks, and served on editorial boards of several journals. He is an internationally recognized authority on photodermatology. Dr. Lim, thank you so much for presenting tonight to our members.
Jean, thank you very much for inviting me to participate this evening. The topic that I'm to cover is on sunscreens 2021. First of all, I'd like to emphasize that the beneficial effects of sunscreens are very well established. We know that sunscreen could reduce the development of precancerous skin condition, also known as actinic keratosis. Sunscreen would reduce the development of skin cancer. And sunscreen would also reduce the development of what we call photoaging, specifically wrinkling caused by sunlight. However, there are other aspects of sunscreens that have generated a lot of questions. I know have generated a lot of questions among many of my patients asking about the various aspects of sunscreens, and I will cover some of the main issues for you. The first one is the absorption of the UV filters, which is the active ingredient of sunscreen, the impact of sunscreen on environment as well as on health, and sunscreens and hair loss. Lastly, to give practical advice on sunscreen. So let's start with the first topic, which is the absorption of UV filters. UV filters essentially are the active ingredients of sunscreen. So if you look at any sunscreen package, on the back you'll see active ingredients. Those are the UV filters. New information on this is shown on this slide. Specifically, this is a study that was done by the scientists at the FDA, looking at 48 healthy individuals. They apply sunscreen on day 1 and from day 2 to day 4. So a total of 4 days of application. They then measure the 6 active ingredients 6 active ingredients of sunscreens in the blood. What was found is that for all these UV filters or active ingredients of sunscreen, they were able to be detected in the blood at a level that is quite noticeable. Furthermore, all the sunscreen active ingredients was also detected on the skin surface on day 7 and day 14. The last bullet is not surprising because we know when we apply sunscreen, we want the sunscreen to stay on the surface of the skin. So it is not surprising. But the first bullet is the one that has generated a lot of interest, a lot of questions, and some concern. I want to emphasize the conclusions from this study, and this is quoted directly from the studies done by the FDA. There were 2 studies. I just cited one of them for you. First of all, the conclusion is that the systemic absorption, meaning the absorption into the blood of sunscreen ingredients, supports the need for further studies to determine the clinical significance of these findings. So this is directly from the article. We know that sunscreen has been in use since the late 1970s. We know also thus far we have not seen any noticeable health side effect of sunscreen. So FDA recognized that. The scientists put this statement in their conclusion. The other very important bullet is that the scientists concluded that these results do not indicate that individuals should refrain from the use of sunscreen, indicating that they feel that the benefit of sunscreen still outweigh, based on the current data, the significance of these absorption findings, and more studies needs to be done. The other very commonly asked questions is the impact of sunscreen on environment and also on our health. For the environment, primarily it is the bleaching of coral reefs that had become a very significant issue for many individuals, and for Hawaii, for example, the state of Hawaii. So let's take a look at what is known. This is the latest and probably the most comprehensive review of this topic. There was it's still in press, but nonetheless, it is going to be coming out sometime this year. A critical review of the UV filters, which is what I mentioned before, the active ingredient sunscreen, the hazard, and also the risk, specifically to corals. What they did is that they review all published studies until June 2020. There were a total of 32 studies on this aspect. What they found is that indeed the UV filters, which is the active ingredient sunscreen, can be found in seawater near coral reefs. But notice the concentration that I have outlined, underlined there, nanograms per liter. The third bullet shows that the 9 studies that had shown toxicological findings of these filters, they were all done in the laboratory setting, but they were all shown to be toxic in a concentration of microgram per liter or milligram per liter. Again, if you think about nanogram per liter versus microgram per liter and milligram per liter, the last bullet is the important one, that compared to concentration in seawater, which is nanogram per liter, the toxic effects that were seen in the laboratory setting was seen at 1,000 to 1 million fold higher concentrations, indicating that the effect in the seawater probably is quite insignificant. In fact, this is the conclusion from this very nice review, that first bullet, there is currently limited evidence to suggest that UV filters are the major cause of bleaching of coral reefs. In fact, we do know that warming of the ocean water is a very, very significant cause of ocean coral reef bleaching. However, the authors also caution that clearly more studies needs to be done. So therefore, I think as physicians, we generally have to keep our minds and our eyes open for new data and be accepting of new data. But based on the data that we have right now, the UV filters and coral reefs, probably the effect of UV filters on coral reef bleaching is a very, very minor participants in that particular effect. The other concern, as I've mentioned, is that the impact on human health. This is again another very recent study that reviewed this particular topic. There were a total of 29 studies, 29 reports that these authors reviewed on 2 UV filters. Oxybenzone and octinoxate is not so important about the chemicals, but these are UV filters that are most commonly to be shown to may have a health effect. What the authors found is that current evidence is not sufficient to support the cause and effect relationship between the elevated levels of oxybenzone and octinoxate and adverse health effect. Notice the relationship is that we highlight there is cause and effect, meaning that is it causing an effect on the health? What the author is saying is that currently there is not sufficient evidence to support that. Let's move on to sunscreen and hair loss. I'm sure you all are very familiar with this topic, and specifically the association of sunscreen and frontal fibrosing alopecia. This is a patient of mine with that. Probably many of you are familiar with this condition, that there is a hair loss on the frontal part of the scalp, usually the front part of the scalp, sort of a receding hairlines as time goes on. And it is quite a significant issue because it is a scarring type of hair loss, and it's very difficult to get the hair to grow back. So what is the association between sunscreen use and frontal fibrosing alopecia? There have been 4 surveys on this particular topic. You can see on the left vertical column, there are 4 studies. In the middle are the number of subjects. You can see that most of the studies have quite a large number of individuals who participated there. The important part is the result. For all the studies, there was an association between the use of sunscreen and the increased frequency of frontal fibrosing alopecia. So there is indeed an association between the two, the use of sunscreen and frontal fibrosing alopecia. So what are the conclusions from this particular review that we did a few years ago? Limitations. All these were surveys. Because of that, it is very difficult in terms of remembering truly in the past year, past 2 years, whatever it is, how frequently do we use the sunscreen? And as importantly, it is very difficult to know what are the types of sunscreen that the individuals have used. That was not the purpose of the survey, and that was one of the limitations of these particular 4 studies. Furthermore, I want to emphasize, association doesn't mean it is a cause and effect. In other words, there is an association, but there is no proof that sunscreen indeed causes frontal fibrosing alopecia. Nonetheless, I think we have to be cognizant of that. Let's take a look at our titanium dioxide, because this is another very commonly asked question, at least by my patients. But what about titanium dioxide? We know that titanium dioxide is present in sunscreen, the so-called physical sunscreen. It contains zinc oxide and titanium dioxide. These are the 2 studies that have reported on that. First one, titanium species on hair shaft in 1 patient. So this is a very small study on 1 patient with frontal fibrosing alopecia. Notice the terminology that was used, titanium species. The authors did not say it's titanium dioxide, because titanium is used as a whitening agent. Titanium dioxide is used as whitening agent, so it's present in other facial substances we put on the face aside from sunscreen. That's the reason is they have very carefully phrased it is titanium species. Doesn't mean it's titanium dioxide from sunscreen. If you look at the second bullet, this is a larger study looking at 20 patients, 16 affected women, 4 unaffected women, and 1 unaffected man. What was found is that titanium species was on hair shaft of affected and also of unaffected women. Again, association, but clearly in this case is not cause and effect relationship. And in the 1 unaffected man, there was no titanium dioxide detected. Subsequent to the publication of our review, a group of experts of American Hair Research Societies performed a survey of their members. There was a 44% response rate, specifically 60 members. The result: the responders believe that sunscreen may promote frontal fibrosing alopecia. Again, we do not know for sure, we know an association. But the important part also is the last point there. The responders did not agree on the potential causative ingredient or the type of sunscreen, either chemical or physical, to avoid, because there is just not enough data. I think this is where the science is on the sunscreen and hair loss, and something, again, as physician, as scientists, and all of you as patients, I think we need to keep our minds open so that if new data come on, be it positive or negative, we can appropriately incorporate that into our decision making, into our judgment. Just to complicate the picture a little bit, this is a very, very recently published study that came out in last month's issue of Journal of the American Academy of Dermatology, the main journal in dermatology. This is a study from Brazil looking at 900 participants, 450 of them with frontal fibrosing alopecia, 450 sex match control, from 11 centers in Brazil. Again, it was a questionnaire study. I mentioned already some of the limitations with a questionnaire study. What was found is that frontal fibrosing alopecia was associated with hair straightening with formalin, the use of ordinary facial soap and facial moisturizer, thyroid disorder, and rosacea. Again, association, not cause and effect. As importantly, just to confuse the picture for all of us, you see the last bullet in this particular study, which is probably, it is the largest study thus far. There was no association with sunscreen use. So I think that at this stage, what we know is that there was some association of sunscreen use, but again, it's not completely clear. I think data will continue to evolve as time goes on. So this comes to the last point of my talk. So what are the practical advice that we as physicians can tell our patients, that all of you as patients, what you should do? So let's take a look at what I would normally suggest. One, as I mentioned in my very first slide, we do know that sun exposure has a lot of adverse effects, from wrinkling to the development of skin cancer. So it is quite well established, and it is clear that photoprotection should be practiced. I want to highlight then, when we talk about photoprotection is the total package here. All of us would say, oh, photoprotection is sunscreen. It is not sunscreen alone. I will show you the bullets here that to practice proper photoprotection, it is seeking shade when outdoor. We all love being outdoor. We all love participating in outdoor activity. There are a lot of health benefits for outdoor activities. So we should go outdoor, but just to seek shade when outdoor, to wear photoprotective clothing, including white brim hat, as well as sunglasses. Only in the exposed area to apply sunscreen. And sunscreen that I would recommend is to use SPF number 30 or above. For daily usage, SPF 30 is sufficient, but if you're going to be outdoor for a prolonged period of time, an SPF 50 would be a better sunscreen to use. Secondly, the sunscreen needs to be broad spectrum. Nowadays, in the sunscreen in the US, it is very easily stated and very clearly stated that the sunscreen is broad spectrum, because broad spectrum sunscreen would protect against the spectrum of UV called UVA. SPF is a measurement of UVB protection, which causes sunburn. UVA is the one that would cause tanning reaction. So you want to protect against both UVB and UVA, and the UVA will be protected by broad spectrum. I mentioned here ideally tinted sunscreen also, because we do know that there are new data coming out that a different spectrum of sunlight called visible light, which is what we use for general illumination purposes, it can cause tanning of the skin, especially in individuals with skin of color. Currently, the only type of sunscreen that can protect against the effect of visible light is colored or tinted sunscreen. So that's the reason that I put down the word there, tinted sunscreen, to otherwise exposed area. I mentioned about the environmental effect of oxybenzone octinoxate. For those who are concerned about those effects, in the US, one can just use mineral or inorganic sunscreen, also known as physical sunscreen. These are the titanium dioxide and zinc oxide containing sunscreen. The slight limitation of that particular sunscreen, that particular type of sunscreen, it causes some whitish discoloration on the skin. So for darker skin individual, a lot of time it's quite difficult to completely eliminate the whiteness, and some patients may not like using the physical sunscreen. How about patients with frontal fibrosing alopecia, the picture that I have shown you before? Again, I've mentioned that the cause and effect relationship has not been established between sunscreen and frontal fibrosing alopecia. However, if one is concerned, one can avoid the use of sunscreens or other products. I put down other products here because recall that study from Brazil showing that other facial products could also be associated with frontal fibrosing alopecia. So while the data is still emerging, just simply avoid the use of sunscreens and other products on the forehead near the hairline. One can use hat and other physical barrier to provide photoprotection. Lastly, with practice of rigorous photoprotection, we know that vitamin D is synthesized by exposure to sunlight. So clearly, if one practices a very rigorous photoprotection, it is important to take vitamin D at 600 to 800 international units per day. And that particular amount of vitamin D is present in the typical multivitamin available in the supermarket and CVS stores and so on and so forth. So one multivitamin a day would be sufficient to maintain, to give you adequate level of vitamin D. So with that, as we looked at the picture of my hometown, Detroit here, I'd like to thank Jean and thank the organization for inviting me. Thank you all very much for listening.
That was fantastic. Wow. What a great synopsis on the sunscreen. We get questioned so many times about this. So thank you very much for making it understandable and educational, because there are a lot of questions, and clearly the science is still emerging. We can see that. So there's really no definitive answers. So we're going to start off. I think we have a few questions for you, Dr. Lim, that came up while you were speaking. The first here is there any difference in using a tinted sunscreen versus regular? I think you may have covered that, but do you want to just summarize again?
Sure. Yeah, tinted sunscreen again is the one that is somewhat colored, and the ingredient for tinted sunscreen is called iron oxide, okay, which is not listed as active ingredient because it is not a UV filter. But because it is colored, it does reflect visible light. That is the reason tinted sunscreen, if they have good SPF, if they have broad spectrum property, it protects against UVB, UVA, but also against visible light. Okay, visible light is the one that can cause tanning on the skin, especially in dark skinned individuals. Those are relatively new data. The challenge with tinted sunscreen right now, it is not as practical as the other sunscreen to purchase because the tint comes in different shades. So it's very difficult for one to know, even for us physicians to know which shade would fit the patient's natural skin tone the best. So a patient almost have to try different shades of tints to see which one would fit and would match their natural skin tone the best.
Right. And so you would say then that may be a deterrent because people don't want to spend money and then have to buy another one and another one, right? So if there was more.
Correct.
Okay.
Yes, I think the industry has to continue to develop to see what is the consumer-friendly way for people to know what type of shade it would be when it is put on their skin. That is a new development that's still being addressed.
Okay, but let's say a patient does find one. It's tinted, it's broad spectrum, and it has SPF. That would be the trifecta, right?
Correct.
It's kind of, okay, so that would be ideal. If you could find something that has those three characteristics, that would be a good sunscreen to use.
Correct. It is especially relevant for darker skin individuals.
Okay, that's good to know. All right, our next question is going to pop up. What about sunscreen for your scalp? Is there such a thing, or do we just use the same as the face?
Very good questions. This facial skin and scalp skin, especially when the scalp has hair loss already, is pretty much of the same texture and consistency. So I would use whatever sunscreen that you like to use on your face on the scalp. Again, being on the scalp, a lot of time actually it's easy also to put on hats and so on. So physical barrier would be another factor, another means of protection. But yes, the same sunscreen can be used.
Okay, that's good to know. Is there a difference between more expensive sunscreens and cheaper ones? Because we all know that you go into the cosmetic store and I mean, there's all kinds of choices and variations. If it has those characteristics, is that really the most important thing?
Price is not the major factor. Fortunately, in the US, the SPF testing and broad spectrum testing is quite tightly regulated. So if the sunscreen say it is whatever SPF it is pretty good SPF. So, you know, my advice usually is that buy whatever sunscreen that you and your family like to use and use that particular one. The very expensive sunscreen does not mean that it is the best sunscreen.
Okay. You know, I have one other question that I just thought of with my family when you were talking. Is the spray sunscreen or the lotion sunscreen? Is there one that's better than another? Because I always think the lotion you get more coverage, but then, you know, sometimes my husband, he's a golfer, he doesn't want to put the lotion on his hands, so he uses the spray. Are we getting the same effect?
Properly used, yes, but let me give some nuances on this. The lotion, obviously, you know, you apply the lotion, it covers the skin quite evenly, especially if you apply it generously, you cover the skin very evenly. So, Jean, you are correct. You know, it is easy to apply, it covers very, very well. Spray, fortunately, you know, it is a spray, so if it is easy to use. That's the reason a lot of men, especially if they have little balding in their scalp, they'd like to use the spray to cover the bald area, to apply the bald area. The challenge with spray sunscreen is that if you think about it, when you put spray, you get mini droplets. So unless you put a lot of spray and then gently rub the area so that you can get total coverage, otherwise potentially if you only spray it once, for example, you'll get a lot of missed area. So the coverage with the sunscreen and the protection from the sunscreen may not be as much. So generally our recommendation is that you have to spray it several times, or else you spray it on your palm and then just apply it on your skin. So those are the ways to make sure that the entire skin surface is covered with the spray.
That's really good to know. Thank you. Are there any ingredients that we must absolutely avoid?
In sunscreen, right now, I think there are a lot of studies that are being done. In fact, FDA is working very closely with industry, or the other way around. Industry is working very closely with the FDA to try to figure out, you know, what are the tests, the additional tests the FDA is requiring because of the issue of sunscreen UV filters getting absorbed into the bloodstream. What are the additional testing that the industry would need to do to prove to the FDA and to all of us that there is no side effect of sunscreen? So right now, what my recommendation is that you can use any sunscreen that is approved by the FDA, which is approved in the United States. There is nothing that you need to avoid at this moment. But again, you know, we have to keep our minds open as the science evolves.
Okay. You talk about association and not a cause with the link to sunscreen and FFA, but I'm really scared to use sunscreen. How do I balance this?
Yeah, I think very, very good question. A lot of my patients ask me about this particular issue. I think keeping in mind what I mentioned earlier on, that photo protection is the total package. So, you know, sunscreen should be used only as part of the photo protection package, staying in the shade when outdoor, putting appropriate clothing, hats, sunglasses, and so on. So sunscreen should be used only on the exposed area. If one is concerned about FFA, for example, then, you know, don't apply sunscreen along the hairline. Just use hat and so on. But at this moment, I think the risk benefit of the use of sunscreen and photo protection, again, the total package, significantly outweighs any of the negative effect that has been reported thus far, because the science is not quite there yet.
Gotcha. Okay. I think this may be our last question. Yeah. Is there any new studies that are going on about this? And can CARF and CARF's patients help to do a study? Or how can we advance this so we can learn about this sooner and quicker?
Yeah. The studies that are going to be the most important one are the one that the industry and the FDA are working on, because FDA has a list of studies that they would require industry to do to prove and to show that this UV filter absorption does not cause any side effect. So I think those are the studies. Unfortunately, those studies are very expensive studies, has to be done in a large number of patients. And so that is the reason that it is going to be quite slow, actually, in terms of being able to get the result, not counting that it is a very expensive study to do also. But nonetheless, I think industry would have to do it in order to make sure that the sunscreen can continue to be available in the United States.
Okay. All right. There's a few more questions I was just told, so we're going to pull up another one shortly here. What would you advise against using shampoo and hair conditioner with sunscreen in it when diagnosed with FFA?
I would. First of all, the use of hair conditioner and shampoo, for example, that may contain sunscreen. If you think about it, when you apply shampoo and hair conditioner and then you wash it off, of course, afterwards, it makes the sunscreen very, very ineffective. There is nothing that's going to be left on the hair and on the scalp in a significant degree. That's number one. Number two is that the use of sunscreen primarily is to protect the skin. There is no good data to show that sunscreen and UV would have significant negative effect on the hair. It make the hair drier and so on. But in terms of developing cancer, developing wrinkling is obviously not going to happen on the hair, nor would it cause any hair loss. So with that, to me, it is not necessary to use shampoo or hair conditioner that contain sunscreen.
Okay, thank you. Can you address the study of titanium dioxide being lumped in with chemical sunscreens as potentially problematic for hair loss?
Yes, so it's a very good question, very commonly asked question. So thank you for asking that. Titanium dioxide, strictly speaking, it is not a chemical sunscreen. It is what we call inorganic, or also commonly known as physical sunscreen. So the FDA classifies sunscreen into two general categories. One is organic sunscreen, also known as chemical sunscreen, octinoxate, oxybenzone, the chemicals that I've mentioned before, having effect on the coral reef, for example. Those are so-called chemical sunscreen. Then the FDA also classified the second group, which is so-called the physical or inorganic sunscreen. Those are the titanium dioxide and zinc oxide. So this is the physical sunscreen, titanium dioxide and zinc oxide, the one that cause some whiteness on the skin when applied. Those are the physical sunscreen. And FDA, in their most recent classification, classified actually the titanium dioxide and zinc oxide to be safe and effective sunscreen. So among the UV filters that they're questioning, they do not question the safety of the titanium dioxide and zinc oxide. They are questioning the absorption of chemical sunscreen. The ones that I show you in the data, those are all chemical sunscreen that are absorbed. So chemical sunscreen, some questions in terms of physical sunscreen. FDA classification is a safe and effective.
Okay, well, thank you. I think we have two more questions and then we're going to wrap it up. Do the sunscreen ingredients build up in the bloodstream or in the hair follicles? How do we remove them from the body?
The very good question. Also, the sunscreen, the study did not look at long-term accumulation. What they did is that this is so far the best study. They look, as mentioned before, they look application for a total of 5 days and show that there is a level in the blood up to 21 days for one of the chemicals, actually up to 21 days. But they did not look at, if you use sunscreen on a regular basis, will it continue to go up? So the data on that part is not known. It gets, in terms of, what is the second part of the question? Could you bring up the question again so that I can...
Yeah.
In terms of how to get rid of it, in the body,
yeah, to remove it, right.
Yeah, to remove it is into the kidney, by the kidneys. It is sunscreen can be present in the urine if people have. So that is well known. So it is excreted just like any substance that get absorbed. It get absorbed and then eventually get excreted in the urine.
Okay. Wow. Okay, the last question. Do sunscreen / sunblock ingredients affect the variations of scarring alopecias in similar or / different ways?
Good question. There is no data on that. The study that has been done all out FFA. So I cannot, we don't have data to answer that question.
Okay. Yeah, well, it sounds like some more work still needs to be done in this area,
Absolutely.
but it sounds like we've got a bit of a handle on it. And I absolutely appreciate you coming out and spending the night with our group. Thank you very, very much for sharing your expertise and being such an advocate for sun care and education. We really appreciate it.
Thank you very much, Ian, for inviting me. Have a good day. Good evening.
Okay. You too.
Bye-bye.
Thank you, Dr. Lim. Bye. Well, that was fabulous. Hi, ladies. We're back on, and we're going to now move to our next lecture. Next up is Dr. Marianne Senna. Dr. Senna is going to be talking about environmental factors in lichen planopilaris and fronting fibrosing alopecia. It's going to focus on questions that still exist around the impact of various environmental factors on these types of hair loss. Dr. Senna is a huge advocate for CARF. She serves on our board, as well as been leading some of our webinars over the past year or so. She's a board-certified dermatologist and assistant professor of dermatology at Harvard Medical School. And in addition to adult and pediatric general derm, she also co-directs the hair loss clinic at Mass General Hospital and is the principal investigator of the Hair Academic Research Unit at Mass General, a clinical trials research unit that's dedicated to hair loss disorders. So we're pleased to have Dr. Senna back on to share this interesting topic with us, and she'll be available to answer questions at the end when she'll be joining Marilyn I after her lecture. So Dr. Senna, the floor is yours, and thank you very much for coming again tonight.
Hi, Jean. Hi, everyone. It's always such a pleasure and really a joy to speak to the CARF audience. So I've been asked to speak on environmental factors in scarring alopecia. And I think an important place to start is on the work of a research group out of the United Kingdom that did a study and identified 4 genes that were involved in the development of frontal fibrosing alopecia. And one of these genes was a xenobiotic. And you might be thinking, xenobio what? Being a Greek, I love to always highlight when something comes from the Greek, and this is an example of that, where the word xenos in Greek means stranger. So a xenobiotic is something that's not naturally found in our bodies, something that comes basically from the outside that can stimulate an immunologic or other response. So this finding really suggests that there could be an environmental factor involved in the development of FFA. I want to start off by discussing lithography. So lithography is a printing process that uses a flat stone or a piece of metal to affix an image using a greasy substance so that the ink will adhere to it. You might be thinking, why on earth are we even talking about this? Well, one of the first cases of lichen planopilaris, or LPP, was described in a male lithographer in 1909. He was a healthy 34-year-old male who developed a patch of scarring alopecia that rapidly progressed to affect his entire scalp over a 3-year period. In the paper, the authors, who were physicians, describe, quote, "The baldness was a peculiar type and different from alopecia areata. There was a scaly condition affecting the whole scalp more or less, but chiefly located at the mouths of the follicles that gave way to hair loss and skin thinning." What is interesting is that there are significant potential occupational exposures with lithography, including lead and heavy metals, and the use of a chemical called perchloroethylene, or PCE. During plate making for lithographic printing, PCE was used to clean the oily, greasy substance off of the plate. An eerily similar case occurred in one of my patients shortly after I started here at Mass General. Again, it was a young male construction worker nearly the same age, 35 years old. And 2 weeks after he was doing intrusive groundwork, digging out a site that was previously a dry cleaning facility site, he described sitting on his couch and his scalp became intensely itchy, and boom, a patch of hair fell into his lap. And he came in and a biopsy showed evidence of LPP. Despite treating him very aggressively, he had rapid progression of this hair loss, losing all of his scalp hair over 3 years. And when we obtained the records from the dry cleaning site that he was working at, interestingly, PCE was shown to be something that he was exposed to. And because of what happened to him and the lack of proper protective equipment that was provided to him by his employer, this case was actually brought to court and went in favor of this unfortunate patient. So when we think about environmental factors, I think that this quote by Dr. Messenger really sums it up well, where in 1994, FFA was first described in just 6 women, and it was rare during the 90s. But particularly over the last decade, it's become like an epidemic. And this is something that's not just happening in the US, it's happening worldwide, really pointing to the possibility of an environmental factor playing a role. We know that FFA and LPP, although they can occur in men, by and large, preferentially affect women. And we know that women use hair and facial products much more than men do. And at least in the US, these are not regulated at all by the FDA. A lot of people, it's amazing to me as a clinical researcher when I think about how much regulation and rigor and study and scrutiny goes into the medications that we pick up at the pharmacy in the back of the drugstore. And yet zero scrutiny goes into all of the things on the shelves between the entrance to the back of that pharmacy. Even more interesting is that in the Journal of the American Medical Association, the internal medicine one, they saw a significant increase over time in consumer reports of adverse effects to hair products specifically. So while there was an increase in various things over time, you can see here in light blue that the hair products were by and large one of the biggest reasons for complaints from consumers. And interestingly, the law does not require that these complaints be made public. They can be kept private, and it doesn't even require that the manufacturers of the product have to report them to the FDA. When you start digging into it, it's really troubling. Add to this the fact that 3 class action lawsuits, 2 that have gone in favor, and 1 for patients, and 1 that is still ongoing, have been related to hair care products. And so it leaves all of us thinking, what the heck is going on? I mean, is this something toxic? Is this something allergenic? And this has led those of us who see a lot of LPP and FFA patients to start doing something called patch testing, which is basically we take a number of different ingredients and each of them is put on a small disc and adhered to the patient's back. So you could have maybe say 80 or more different ingredients on your back, and you wear them for a few days, and then the patches are taken off, and the physician 2 days later, and then again 4 days later, looks to see, have you developed an allergic reaction in any of those spots? Okay, so when we at Mass General came up with a very comprehensive patch testing panel with the help of 3 contact dermatitis experts that would cover all personal care product related potential allergens that are used on the head and neck, we were shocked to find that 76% of our tested patients were positive for clinically relevant allergens in cosmetic and personal care products that they were applying to their scalp and face. Now, what does this mean? So when we do these tests, there can be no reaction. There can be an equivocal reaction where you're like, is it a little bit pink? There can be a +1 reaction where it's red. There can be a +2 reaction where it's deep red. And there could be like a 3+ reaction where it's like blistering, okay? We did not include ± reactions. We only included reactions that were +1 or higher. And that's really important because in a lot of studies, they'll include the equivocal reactions. We did not. We also did not include things that we did not feel were relevant to LPP or FFA. So for example, like a high percentage of the population will be positive to nickel, but that's really not relevant to people for LPP and FFA. So we didn't count that. So that's important to know too. And there were no differences in the rates of positivity between patients who had LPP and patients who had FFA. Now, when we compare our data to other people, even in other countries who did a similar thing, not only do we see that the same types of allergens come up again and again, namely fragrance, linalool, which is like a citrusy, all-natural ingredient that's ubiquitous in products, ammonium persulfate, which is found in bleach, in hair dyes, benzophenone 4, MCIMI, which is a preservative that's ubiquitous in products, and balsam of Peru, which is another fragrance. So not only do we see these same ones coming up again and again, but in the brownish yellow column or tan column, this is the best example we have of the rates of allergies in the general population, meaning if you just picked a random person off the street and patch test them. And what I want you to see here is just how much higher these rates of allergies are in the LPP and FFA population. When we looked at our patch testing results and took the patients who had been patch tested and we said, okay, listen, you have to have been on at least 6 months of a consistent regimen. You can't have changed anything else in the past 6 months. You have to have been stable on your regimen. The only thing you're going to change for the next 3 months is avoiding the allergens that you tested positively to. In the patients who reported scalp itch, 58% of them after 3 months reported a decrease in their scalp itch. 73% of patients reported a decrease in their scalp redness or erythema, fancy word for redness. And on exam, and I was not aware of their patch testing results, I looked at this retrospectively going through the charts, 70% of patients on exam also had reduced redness, and no patient had signs or symptoms of worsening LPP or FFA. So what does this mean? I mean, again, we can't say these products cause LPP and FFA, right? But it does make me wonder, could this be part of a piece of the puzzle? Now, you know, there are probably various factors that impact why a given individual develops LPP or FFA. But I really do think that this is a big piece of the puzzle that we need to address. And the way that I think about it is not that LPP and FFA is just plain old regular contact dermatitis. But I do think that what I would do if I was an LPP or FFA patient is either get patch tested myself, done well and comprehensively, which is important, or just empirically avoid the allergens and use products that don't contain them that were very common in this patient population. Because there's really no benefit to using products that contain these things. So the way I sort of think about it, and this is kind of a flow chart that's adapted from a recent publication in contact dermatitis, is that, you know, patients probably have an exposure to this outside agent. So say a chemical in a product that you're using on the head or neck. The individual might be slightly genetically predisposed, right? Maybe there's something off with their xenobiotic processing enzymes. They get sensitized, and then there may be other mechanisms involved, which activates the innate immune response, which is like those first immune cells that get stimulated to respond to something like this, that causes the hair follicle natural protection or immune privilege to collapse and leads to the development of FFA and LPP. Again, this is a hypothesis and my very strong hunch. This has not yet been proven, but we are doing further studies now to see if some of these chemicals can contribute to the hair follicle immune privilege collapse, that protection that prevents immune cells from attacking the hair follicle, or in some other way to the development of LPP and FFA. So more to come. We're actively doing the research now to better understand these observations. But again, you know, for now, I recommend either avoiding these ingredients and using products that don't contain them, or comprehensive patch testing, like I mentioned. What's funny about all of this is that when I started asking patients after we did this study and we got the results, you know, do you find that you're sensitive to products? Do you find that you have, you know, you get rashes from time to time? When you ask that question, I was shocked at how many women said, like, yeah, I have I have very sensitive skin. I react to things all the time, which, you know, is a pretty reliable sign that, you know, the skin is responding to something from the outside, and certainly goes along with what we're seeing with our results from our patch testing. So I can't do this work that I do without all of my research fellows, research team, mentors, nurses, other staff members. Like I said, it's always a privilege to be here. And I appreciate the invitation. I'm happy to take any questions after Marilyn's done speaking. Thank you.
Great. Thank you, Dr. Senna. That was excellent, very informative and educational. As Dr. Senna reminded everybody, please post your questions in the chat box for Dr. Senna and as well as for Marilyn as she's going through her presentation. We try to keep these meetings as concise as possible, and we know we've committed to you to be off at 8:30. So make sure you get your questions in so we can address them all at the end. And so now I am going to introduce Marilyn I. Marilyn is a longtime member of CARF. She attended her first support group meeting in San Francisco back in October of 2007. And she has quickly became a dedicated and caring CARF volunteer advocate soon thereafter. She's been serving as CARF's patient outreach volunteer for 11 years, and she is always connecting with newly diagnosed patients to listen, support, and provide inspiration. So over the years, Marilyn has gained so much knowledge from talking with other patients and her own personal experience. She very much loves to share what she knows with others. I had the privilege of meeting Marilyn when I first started working at CARF, and she gave me one of my first understanding and breaking it down so that I can have a better understanding of what people and patients are going through with scarring alopecia. So she's a wonderful advocate. I'm going to turn it over to you now, Marilyn, and you have the floor. Thank you.
Thank you, Jean. My presentation about summer tips in stress reduction includes heat and cold, sweat, and stress. For follicle inflammation, heat is bad, cold is good. Heat exacerbates the inflammation that's inside the hair follicle. Cold calms it and soothes it. So how do we soothe the inflammation? One way, you could use an ice hat, frozen bag of peas, a Ziploc bag full of ice cubes, which if you look under there, there's a paper towel, or you could use a thin washcloth to keep that plasticky feeling away. But my preference is the gel pack, the microwavable, freezable gel pack that you could buy at like CVS, Walgreens, whatever. And the reason I like it is because it goes further down over my FFA. Do it as often as you want, you know, put the ice or peas or whatever on your head for 15 minutes, throw it back in the freezer. You can't overdo the cooling effect of ice. One other thing that you need to consider is breathable hats, because heat is trapped inside most baseball hats. So you want something that's going to be cool and well ventilated, breathable. If you're wearing a wig, Ask yourself, could I maybe use mini hair pieces instead? Well, I'm not going to get into this, but you can go onto the CARF website, scroll down to support, look under tools and hair care tips, then mini hair pieces. If you're a CARF 365 member, there's a fantastic video that shows a step-by-step application of these mini pieces. Instead of wearing like a full wig, maybe you've got a CCCA right here, and you could put a custom hair piece in that one area, and you'd only tape it onto the area already that's had hair loss. BioFreeze is something I learned at the Louisiana support group, and it's also distributes cold onto the skin. So say you can't wear an ice pack because you're going to work. Maybe you use a spray, but whoa, be careful you don't get it in your eyes. Or use the gel. And if you're going to use the gel, make sure you wear a glove, because the last thing you want to do is just use a hand and then maybe touch your eye, and oh, are you going to be in pain? When you're shampooing your hair, consider when from here down as hot water as you want, but from here up, cooling. Back off the heat, because once again, heat exacerbates the inflammation and cold soothes it. At first, it feels kind of weird to have cold on your scalp, but then you start getting used to it. And now it's like when I see my hairstylist, she doesn't even turn the heat on at all. She just puts it straight on cold, and I just sit there and purr like a little kitten. It's wonderful. When you go to blow dry your hair, put your hand on your scalp to deflect the heat, and then blow away from your hair, or your head, so that you don't have that heat going in there onto your scalp. Now, speaking of shampoos, this is a quote from Dr. Vera Price, founder of CARF. When working out at the gym, don't wait to go home to shampoo your hair. Shampoo it at the gym. Why? Because we all know that there's salt and other nasty little chemicals in sweat. So those little chemicals are going to be just doing a number on those inflamed hair follicles. What can you do about it? Well, one gentleman with folliculitis decalvans, when he's on the treadmill, he was sharing how he would bring a little Ziploc bag of vodka and some tissues. And when he starts sweating, he'd jump off the treadmill, dip it in, rub it around, cleanse his scalp, and away he went. So he was reducing that inflammation response. You can also use, like say you're out in the garden and you're going to be working all day outside. Well, you can't just come in every 5 minutes and shampoo your hair, but you can come in and dunk your head in the sink and rinse it, because that helps reduce the pain and the itching from the inflammation. How do you stay cool and keep from sweating? Well, one way is, once again, the ventilated hats. And then when you see on the mannequin there is what they call a cooling towel. And I have one here. And basically you get it wet, kind of snap it, bring it around, and then off you go. When it's 108 degrees outside and you're feeling really, really hot and sweaty, this keeps you cooler. And the material on a cooling cloth retains the moisture better than just a regular washcloth or a towel. And they come in all sorts of colors. So I even have one for my favorite race car driver, Chase Elliott. So look around, see what you can do, but keep yourself cool. And if you don't like hat hair, an umbrella. Really simple and stylish. Now this is a NAMU hat, and when I was first diagnosed with FFA, I quit swimming. I just didn't want to swim. I was too embarrassed to go out. But then I found out about NAMU hats, and they come in all sorts of styles, and this is the one that matches my swimming suit. It's a pretty little color here, and you can see how it ties on the back, and it's very comfortable, and you go into the water, you get out, and the cool thing is this keeps you your scalp cooler when you're out in the sun. So namuhats.com or on Amazon. When you're swimming and you're no longer stressed out, think about this. What Dr. Vera Price said. Stress doesn't help any disease. Of course not. Think about when you were going back and you had nothing but issues in your life, just one stressor after the next. And the flu bug or the common cold came around and found you. Kicked you on your bottom, didn't it? Well, other times when everything was going great, you had no issues, and the flu bug and the cold was going around, all your friends are dropping like flies and you're not. Because stress really exacerbates all health issues. When I had my second flare-up, I came up with this breathing exercise that I could do anywhere, anytime. Because on my second flare-up, I realized that it took my body almost a month for it to be, my scalp to become sore and tender and itchy. And if I touched it, I'd actually yelp out in pain. And I didn't want that anymore. So instead of going to yoga where you're relaxed for an hour on Monday, Wednesday, and Friday, you can do this deep breathing exercise anywhere, anytime. And we're going to do it together. But first, I want you to ask yourself, on a scale of 1 to 100, how, with 1 being you're so relaxed you're almost comatose, and 100 being you're about to explode into a billion pieces, you're so stressed out. Think about that number, what you are. Now, we're going to do the deep breathing exercise, and the way this works is you take a long, deep, lung-expanding inhale, and on the equally slow exhale, think, nothing is worth my health. Okay, we're going to do it, but first I want you to kind of sit up, relax your shoulders, your neck. You have to twist your neck a little bit, fine. Okay, ready? Begin. Inhale. 1, 2, 4, 5, 6, 7, 8. Exhale. 1, 2. Inhale. 5. Exhale. Nothing is worth my health. Inhale. 3, 5. Nothing is worth my health. Relax those shoulders. Inhale. 5. Exhale. Nothing is worth my health. One more time. Exhale. Nothing is worth my health. Now on that scale of 1 to 100, what's your number? If it decreased just a little bit, you need to work on your stress management. If it drops significantly, you're on your way to changing your life. Because when I started doing this, I knew I needed something to be able to teach this old dog new tricks. And I gave myself 4 months to be able to re-educate myself on stress. And I did. And it made a huge difference. Now, once stress has kind of taken hold, I recommend that you do a slow stroll. What's a slow stroll? Pretty simple. You take your camera by yourself, no people, no pets, and you go someplace pretty. Maybe it's your own backyard, maybe by a creek, maybe it's, who knows where it is, but you're going to take picture after picture after picture. Maybe you're taking pictures of the bark on a tree. Maybe you're taking pictures of leaves. Maybe it's a beach scene. You never really know. where you're going to wind up, but enjoy the moment. Right now, I'd like you to look at something that's on your wall, a picture that's on your wall. I want you to see that picture with fresh eyes. Look at the color. Look at the dimensions of it. Look at the frame. Look at the subject matter. Really look at it again with fresh eyes. And that's what I want you to do out in the outdoors when you're looking at the color and textures of these things and taking a picture for 1 solid hour. You're going to have, when you're at the end of the hour, you're going to sit down and go through and delete a lot of the pictures because, okay, they're not the best, but you're going to have some favorites. My daffodil photo's right there. I framed it and have it on my hearth as a reminder of the peaceful walk I had at South Lake Tahoe one spring day. And when I look at that picture, I remember that feeling of peace and tranquility. So consider that as something you can do as a reminder that you want stress reduced in your life. This last one, I've never read this book, but my mom told me the premise of it. You are not the target. Sometimes when people get really angry, they shoot nasty, angry arrows at people. Say you're sitting at your desk and the boss walks in and he says, "Why did you move the stapler from the right side of the desk to the left side of the desk? You know I don't like that." Now you could freeze up, take that stress in, and let those poisons work inside you, because that's what stress is. It fills your body with lots of poisons. Or you could ask yourself, am I the target? You're not the target? First thing I want you to do is feel sorry for your boss. Because if you're feeling sorry, you can't be stressed out. Maybe he got a bad diagnosis. Maybe his wife left him. Maybe he was hit and run on and sideswiped on the way to work. You just don't know. So have compassion for him. If you incorporate these tips that I've been sharing with you, it will make a difference in your life. It'll change your attitude. Right now, think about how many minutes you spend worrying, fretting, stressing out over your hair loss. How many minutes do you want to spend worrying, fretting about your hair loss? It's up to you. It's your attitude. Maybe you'd rather be like these ladies having a good time. So in conclusion, I'd like to thank CARF, the volunteers, those who've donated, because without your donations, CARF wouldn't be here. I'd like to thank Michael, who's an excellent producer for this webinar. I'd like to thank the doctors, the volunteers, everybody who's ever done anything to promote CARF. I'd also like to thank my cicatricial sisters who, because of privacy, are going to hear the nicknames: Lo, Star, Sista D, Wyoming Sis, big hug Wyoming Sis, and to my PowerPoint guru, the Spy. Thank you. And to Genius. Oh, I call her Genius, by the way, and feel free to, because Jean has worked miracles with CARF. Thank you.
You're such a love, Marilyn. You really are. You are such a ray of sunshine. When I listen to you, you really inspire and you have really good advice, and you're very charismatic. So thank you very much for being a part of CARF and donating most of your time to helping these patients. Okay, so now we're going to go into our questions. I've been alerted that we have about 12 questions, which is perfect because we want to wrap up around 8:30. So this is going to go to Dr. Senna. What is PCE? Would it be present in hair color or toner products?
PCE is a long chemical name, perchloroethylene, and it's usually in degreasers. It should not be in hair care products, but it's basically, I gave the examples to show that exogenous things through occupational exposures or other exposures can lead to a diagnosis of LPP or FFA. So I am not aware of it being in any hair care products, but use those two examples because of them being such obvious, patient cases where people developed really fastly evolving LPP.
Okay, thank you. Okay, so what information should I provide to my dermatologist regarding the products I use to possibly discuss eliminations or changes? So I think this is a kind of a double question. Marilyn, I think you probably can give some perspective on how you would discuss it with your dermatologist. And then Dr. Senna, maybe you can answer on how you would respond as a doctor.
Well, I just want to start real quick if I could, and then Marilyn can talk about how she would bring it up. But for everyone listening tonight, you might recall that in one of the recent CARF newsletters, my research associates actually put together a synopsis of the research article that I spoke about tonight. And in that newsletter article was actually a list of all the ingredients that we recommend avoiding. And your dermatologist might have access or should have access to something called the CAMP database, C-A-M-P, like a summer camp. And this is a database put out by the American Contact Dermatitis Society, where you can put in those ingredients and it will spit out for you a list of safe products that do not contain any of those ingredients. And so this is what we routinely do for our patients. We give them the list of what to avoid so they can check the products that they're using to make sure that they're not in there. But we also give them a safe product list by email so that to make it easier for them and so that they're not overwhelmed, they can go to the category that says shampoo, and there's a number of things that they know are safe to use.
In talking with your dermatologist, you have to provide really good information. And if you notice something that is bothering you, bring it up. Start making lists of different things, and eventually you'll see a pattern. But it's really hard. You have to be your own best detective to figure out what's going to help you and what isn't, because our bodies are also different. Some people are allergic to wool, some people aren't. It's just, some are allergic to fragrance. I've got one friend who I think she's allergic to everything. So she's found her own protocol, and we each have to find our own.
Which is where the patch testing can really be helpful. Sorry to cut you off, Jean, but that's where the patch testing can really be helpful when it's done correctly. And I'm happy to share that information with Eugene if it's helpful, like, the comprehensive ingredients that we recommend are tested. But it is a lot to go through. It's a week, right? So it's 3 separate clinic visits, and that can be understandably difficult for people with work, especially in a pandemic now. And so we provide this other information as a proxy to try to help patients.
And so for everybody who's listening right now, know that we have taken that article that Dr. Senna mentioned at the top of this question, and it is published in CARF's newsletter, and it is available, I believe, on our website. So, and I know some people have cut and pasted it and put it in some of the Facebook groups and things like that. We're also going to include that website that Dr. Senna mentioned. We will add that on to the email when you get the live link to this, when you get the link to this taped recording. Okay, so the next question.
And a subscription. Sorry, you will need a code and a subscription. You can't just log in and put in the ingredients. So a dermatologist's office needs to be able to do that for you.
Okay, so we'll at least put the name of that so it can remind our members when they go see their derm that this is a website or some place that you would like them to look into for you. Okay.
And Jean, I'm happy to talk offline with you about putting one together for patients with cicatricial alopecia, not only the safe products, but products that my patients really seem to like. And we can talk about, providing that for you for the members as well.
Yeah, that's a great idea, because I think we have a webinar that's going to be coming up after the next couple webinars, and it's all about products and treatments and things that you can do. So that may be a good piece of information to include in that. Okay. Next question. How often should someone with scarring hair loss patch test? Is this administered by a dermatologist?
Yes, so it should be administered by a not just any dermatologist, but like many of you have probably found with LPP and FFA, it should be a dermatologist who really knows about contact dermatitis and is skilled in patch testing. It's also important, like I said, that the proper ingredients and a comprehensive panel of testing is done correctly. Because if they're only doing a third of the allergens, you could potentially be missing 2/3 of, that might be a product that you're allergic to. Again, I just want to point out too that it might not be frank allergy. So what's interesting is some patients who didn't necessarily test positively or significantly positively to some of the ingredients also found benefit sometimes in not using products that contain certain ingredients as well. So like I said in my talk, it's hard to know if it's sort of a toxic, noxious effect that these chemicals are having, but definitely in some, it's a frank allergic response that we see. And as far as how often to do it, usually, if you haven't had patch testing done in 10 years, similar to food allergy testing for people who have food allergies, if you're still having GI issues or whatever, that would be a reason to go ahead and repeat it. But if it's done properly, I would say once every, 10 years is more than sufficient.
Oh. Okay. And now I just popped into my head, is this something that just a dermatologist, or does an allergist, if you have an allergist, is that something that an allergist can run this patch test?
So an allergist can do it as well, but you want to make sure that they're skilled specifically in patch testing. Some are and some are not. Okay. And skin prick testing, where they prick your skin, or the blood testing, that's totally different testing. That's for the acute allergic reactions, right? It needs to be patch testing, which is different.
Okay. Okay, good to know. Once the immune privilege is removed, can it be restored completely by stopping exposure to the chemical, or is it gone for good?
Yeah, so that's a really good question, and a lot of work needs to go into understanding all the components that can try to restore the immune privilege. So again, we're doing follow-up studies right now where we're trying to first see the effects of these chemicals on the immune privilege, and then the next step would obviously be to determine whether or not, there's some way, either through medication or avoidance, that could restore it. My gut feeling on this is that, if you've been using a product for 20 years and you've had, LPP or FFA for a very long time, it's likely that that process has been set into motion for so long that although the avoidance will make it a little bit better, you may still need some degree of treatment, right, to reduce the inflammation. Whereas if this was something that is more recent, and it's possible that you'd be able to have a better chance at resetting that immune privilege. But the bottom line is, once this process is set into motion, the most important thing is removing inflammation, right, to prevent further damage to the hair follicle and symptoms for patients who have the symptoms of itch and burning.
Marilyn, do you have anything you want to add? I don't know if there's some patient perspective on this.
What Dr. Senna was saying was interesting because it just reminded me of, I used to use oatmeal soap years and years and years ago, and I used it with no issue whatsoever. Then all of a sudden I started breaking out and I went, what's going on here? And so I took the old soap, looked at the ingredients, and they added some new improved stuff, and boy, was I allergic to it. So just because you're using something for a while doesn't mean they haven't changed it. So
that's a great point. And Marilyn, I'm really glad that you brought that up, because a lot of those class action lawsuits against hair care companies, if you look at the products and the lines that have been implicated in the class action lawsuits where people have blamed inflammatory and other forms of hair loss on the products, they're very high in something called formaldehyde releasers. So these are products where the ingredients will not say formaldehyde. They'll say like DMDM hydantoin, quaternium 15. And again, this is in the list of products that we gave Eugene, so they'll have access to that. But what's important is when these products are sitting in the bottle, they're releasing formaldehyde over time. That can't be good for the hair follicle. Who would put formaldehyde on themselves? And in the past year, I've been made aware of the fact that even ketoconazole shampoo, both Nioxin over the counter and the prescription ketoconazole shampoo, both have now added formaldehyde releasers to them. And so I've told all my patients to stop using them. I mean, it's really terrible what is going on here. It makes it so hard and so frustrating for us as physicians trying to, counsel patients on what the right thing is to do. But for patients, I mean, it's completely overwhelming to try to sift through all this information. So I think it's really important to provide CARF with a safe product list for a face and head for head and neck products that women and men are most likely to use. So I'll have my team work on that, because I think it's increasingly important.
Absolutely. And I'm sure our members and our patients will really want to have access to that. So much appreciated. Okay, our next question is, should we avoid allergens and fragrance for head and neck only, or should we avoid in soap to wash hands and body lotion?
Yeah, so that's a really good question, and understandably a question we get a lot. So here's the thing. I mean, allergen avoidance can be really tricky until you start to find products that you like and that work for you, right? And so if we're talking about, just improving FFA and LPP, and I've seen improvements in patients who have those conditions and rosacea also with allergen avoidance, then yes, it's just products that you use on the head and neck, right? Mm-hmm. But like I was saying, a lot of patients notice, gosh, I never put it together, but yeah, I do occasionally get hives, or yeah, I do occasionally get a rash in my skin folds. And that's because the allergens get trapped there, right? And we naturally have skin-on-skin occlusion, so it drives it further into the skin. So you might not have a rash all over, but if you're like, oh, gosh, I'm itchy or whatever, I mean, I would listen to that, and that would be a reason to maybe think about avoiding them in those products as well. But as far as putting them here and worrying about it here, I would only think of that in cases where people have like a 2+ or a 3+ reaction on patch testing, because in those cases, diffuse stimulation of contact dermatitis has happened.
Interesting. Okay, we have another question, and it's somewhat long, so we broke it up into 2 bubbles. So I'm excited to hear about ongoing studies, and I also have heard some of the restraints with studies is lack of participants. How do we get involved with a study for LPP or FFA? Is there a central registration that those interested could submit their name? Great question. Yes, we hope so someday, right?
Well, CARF is really great with that, and we will be having so a lot of our clinical trials have been on hold now because of COVID and, wanting to protect study subjects. But we will be having 2 really exciting clinical trials at Mass General coming up probably later in the summer or fall. And so my plan is to let CARF know about that and make it clear the number of visits that would be required to Boston, et cetera. And for patients who would be interested, they or people could be interested, they could contact our research team and learn more about whether or not they'd be eligible. So that's one. CARF is a great resource for that. Also, if you go to clinicaltrials.gov, G-O-V, so clinical trials with an S.gov, for those of you who might not be aware, you can search by diagnosis, and all of the active clinical trials should be registered with clinicaltrials.gov and should show up there. And we'll also show whether or not they're still enrolling subjects or not. And that's for any diagnosis, anything, not just hair loss. And then, as far as participation, I've been very lucky at Mass General. I have to say the LPP and FFA community is amazing. They're so dedicated to wanting to figure out what is driving this. And I hear patients of mine saying all the time, even if this doesn't help me, I hope some part of this helps someone else. And that's really just such a testament to this community. And it inspires me to want to do so much more. So we'll work with CARF to make sure that information's known.
Well, and the other thing I wanted to tell our members is that I was also part of the American Hair Research Society talk on last Saturday, and it was all the investigators and the scientists who are studying cicatricial alopecia, like the big names. And I was able to do a presentation at the end about CARF to inform them that we are a patient advocacy group that is growing every day. I mean, we have so many patients that are joining this organization, and we are getting their diagnosis. They're telling us their FFA, LPP, CCCA, and all the other types. And so we have this resource. We are a pot of gold for investigators if they want to do studies. That we have patients, and I know our members will chomping at the bit to do something. So we're making some traction. We're making some headway. Okay, next question. I live in New Mexico with lots of juniper, January through April, 3 years remission, but have scalp itch during that time. Would you recommend a patch test?
So I think if there's an obvious thing, so for example, you obviously get a itch or rash with one thing that you're exposed to all the time. Something like juniper, if it's outside and around everywhere around you, it's very hard to avoid. But this might be a situation where you might consider during those months, if you're able to, if it doesn't interact with other medications, taking a twice daily Zyrtec or a twice daily Allegra, in addition to whatever other treatment you're doing, which are antihistamine medications over the counter that can reduce that allergic response. So that's probably what I would do in a case like that, where it's sort of a seasonal thing and everywhere and hard to avoid. Outside of that, if it's a specific product, obviously, that you notice, like Marilyn was just saying about her oatmeal mask or whatever it was, that obviously you stop using that. And if it's multiple products, that's when you really need to start thinking about patch tests, because it's probably a specific ingredient, and sometimes it's hard to tease out which ingredient it is.
Yeah.
On this, this is Zyrtex. Let's see if I can get this up here. And I use this during the blooming season because I have certain allergies, and my husband really appreciates it because when I use it, I don't snore. So there are other benefits to Zyrtex rather than just the inflammation. So keeps a happier marriage.
All right, we got another question. Marilyn, have you changed how you manage stress during the pandemic? How do you do it when you are very people-oriented and now we are all home all the time? Good question.
Because I reach out to so many different patients that to someone to talk to and who understands and what it feels like when you're first diagnosed and you feel like a freak and everyone's looking at you. To going through all of these different feelings that I had, but by reaching out to these ladies and gentlemen, I know I'm helping. And this has really given me a purpose in life. It's made me, I know this is going to sound weird, but I mentioned this at a support group recently. I'm glad I got cicatricial alopecia and went through all of this crazy stuff where my scalp would burn and itch and all these things, because I know what it took to get through it. I know what it took to find acceptance, and it's not easy to get there. It took me years. And tonight, if people just take some of the things that I've shared, take them to heart, it'll make a huge difference. So as I'm sitting here talking to a patient, say for an hour and a half to 2 hours, and sometimes longer, I'm making friends. So the pandemic isn't bothering me. It did at first, but I went back to doing my deep breathing exercises before I'd have to go into a grocery store. I'd sanitize myself down, everything, the whole car, everything, it seemed like, when I get back in. But then I finally switched my thinking and my attitude, and I said, I'm going to quit worrying about it, because all that's going to do is stress me out and take me down and make me more susceptible to getting COVID. So I do my deep breathing, I do my slow strolls, I talk to people, and I love it.
Yeah, that's excellent. That's excellent. So it looks like we have 5 or 6 more questions. So would sweating during exercise cause my scarring hair loss to flare?
So Marilyn did a great job at talking through the ways of reducing, the excessive heat and getting some of the sweat that, can remain on after exercising or gardening or whatever off the scalp, which is great. What happens, so think about if you had poison ivy and you add heat to it, that's going to be miserable, right? You're going to feel itchier. It's going to be redder, more red. If you put an ice pack on it, it's going to cool it down. Why is that? Because if you're in a hot room, your face gets red. Why is that? It's because your blood vessels in your face open up, they dilate. When that happens, it allows not only more blood to get to your face, but potentially if there's a lot of immune cells, it helps more immune cells shuttle there as well, right? But it's temporary, and then those blood vessels go back down and to their normal size. And what cooling does is it vasoconstricts, so it makes the blood vessels a little skinnier, so you don't get as much blood flow. Now, when you get a lot of blood flow, not only do you get the redness, the more red complexion, but that emits heat as well, right? So your cheeks feel more hot and when they're red. And so a lot of people will think that they're flaring because their itch is more pronounced, their scalp feels hot, and we associate that with, oh my gosh, this must be getting worse. But if it's transient, meaning it's only lasting while you're exercising or while you're outside and then you're able to cool down, that shouldn't cause a flare that should be really relevant to the overall progress of your condition. I totally agree for comfort purposes, and certainly for people who might be in occupations, who have hobbies, who are constantly having heat on their scalp, to find ways to reduce that. But if it's like every so often you're getting hot and that's creating you to be more itchy or red, I wouldn't overthink that part of it.
Okay. Next question. Did Deva Curl have PCE in it?
No, like I mentioned, PCE is, to my knowledge, is not in any of these products, but the formaldehyde releasers are in many of them.
Okay. Marilyn, what are your thoughts on CARF support groups? Do they help with stress? I saw you were a group leader.
Yes. When I first went to my first support group meeting, I thought everybody was going to be sitting around, crying in their beer. Boy, that was the last thing it was. It was informative. I met people. I saw that people had great ways of camouflaging, and it gave me confidence. I think it's really, really important when we're able to go back to be in person for people with cicatricial alopecia to meet others and see them eyeball to eyeball. It's one thing on a screen. It's another thing entirely to see them in person and see just how well we do with camouflage. Support groups are great because sometimes you can cry. Sometimes you share tips. We do an awful lot of laughter because I'm a bit of a ham, and I prefer laughter over crying. So if I can keep a positive outlook, then that's what I want. I want people to go forward and enjoy life, because cicatricial alopecia can rob you of your hair. Don't let it rob you of your happiness. Support groups are worth it.
That's great. Good endorsement for CARF support groups. We'd love you to join. We have them forming all the time. I think we're up to 13 or so now, and we have more people that are interested in starting support groups. So there's probably going to be one near you if there isn't already. So come to our website. All right, next question. Dr. Senna, is there any info about using saunas? Should those with scarring hair loss avoid that? What about hot yoga?
There's no data on this. I mean, I would say this. If you find that every time you go into a hot sauna, your scalp is itching and you feel like it's hot and it's bothersome to you, and you're doing that every single day, probably not advised, right? But if it's something that you do and it's not bothering you a whole lot, it's probably okay to do intermittently. Again, that's not based on evidence or a study that someone did. It's based on sort of how I would approach it if I had the condition. I mean, I think it's different to some extent in every individual. Like Marilyn was saying earlier, I think that's very true. And so I think it's important to listen to what your body is trying to tell you in those cases.
Okay. 3 more questions. We've got, go ahead.
Okay. There are times when if my scalp is broken out a little bit and I sweat, it does itch. And I'm aware of that. So I rinse off and shampoo just as fast as possible. And once again, I listen to my body.
Okay, next question. Move to a city near railroad tracks and a storage area for railroad cars. Would PCE be found in this area? I have had LPP flare-ups since.
So again, I'm not a PCE expert. I'm not a chemist. These are just 2 case reports where probably PCE led to that because it was directly getting onto the scalp in a very concentrated manner. I mean, I think that there would be a lot of problems and a lot of people if there was enough PCE from a railroad around, that you'd see more issues because it can be carcinogenic and everything else. That if it was in enough concentration to be causing hair loss, that you'd see a lot of other things going on. So I wouldn't put too much concern in that.
Okay, good advice. Have you noticed an association between eczema and FFA?
Okay, so this is a really good question. Eczema, so there's frank eczema where a kid is born and they've had eczema since they were a kid, and sometimes that persists into an adulthood, and other times it just goes away, right? And in kids, it can be all over, but usually in adults, eczema or atopic dermatitis affects certain body areas, the inside of the elbows, the backs of the knees, the eyelids can be another place in patients who have severe eczema. And then, like, there are some people who are just covered head to toe, right? But contact dermatitis, allergic contact dermatitis, looks exactly like eczema. In fact, if you biopsy it underneath the microscope, it's an eczematous dermatitis, meaning it's a skin eruption that looks like eczema. And there's nothing about it that says, oh, this is, inherent eczema or atopic dermatitis versus a contact dermatitis. And so I think if a patient with LPP or FFA has eczema, especially if it's like adult onset out of the blue, you don't have a strong family history, you don't have, you didn't have it as a kid, I'd say comprehensive patch testing.
Excellent. Okay, this is our final question. So, should people with FFA avoid the use of skincare and cosmetics containing titanium dioxide?
Okay, so great question. And as Dr. Lim alluded to, there's survey data, but there's not a lot of great data on this. What do I do for myself and my family, and what do I tell my patients to do? I avoid the chemical sunscreens. My feeling is if they're killing off coral, why the hell do I want to put it on my face or anywhere else? So that's just me, okay? The second thing is with the titanium dioxide, in my heart of hearts, I don't think it's an issue. But if it's a question mark, again, why not just use zinc products, right? I mean, so I use only products that are zinc physical blocking sunscreens. And yes, they're a little bit, whiter, but a lot of the companies are catching on to people's desire to want to purchase these products. And so they're making them be a lot more sort of cosmetically favorable to use and put on.
Well,
and
that
you want
is
to
just
watch, by the way, for these, chemical sunscreens and makeup and facial moisturizers.
Yeah.
Nix them.
Okay.
Because they're hidden in
Wow.
a lot of those things.
It's amazing what you learn on one of these webinars. This is fantastic. Thank you, ladies, very much for talking with us. This has been so enlightening, and I'm hoping that all our members and our patients who are watching this tonight really gained a lot of knowledge. And this is just one of the steps that we're taking to help educate the community and bring us one step closer to living happier and healthier lives with scarring alopecia. So I appreciate your time. Thank you, Dr. Senna. Thank you, Marilyn, very much.
I learned something from Marilyn, so thank you, Marilyn.
Okay, and so now I'm going to wrap it up here. Thank you all for attending and coming to this webinar. I know we ran a little bit over. I want to first say thank you to the International Association of Dermatologic Patient Organizations, aka also known as Global Skin, for sponsoring tonight's webinar. Our heartfelt gratitude to you for supporting this educational program. I also want to provide a reminder that this webinar has been taped in its entirety, and it will be available for everyone who participated tonight or who was not able to attend or came late or missed something or wants to hear something again. Know that you will get an email from us at CARF with the link, and we'll also provide some of those items that Dr. Senna talked about in that email as well. So don't panic if you don't get it for a couple of days. It does take us a few attempts to try to get this all organized and get it out to everybody. So please just sit tight, and we will be sending that out to you shortly. And then the next thing is we are actually conducting a survey. It's about to be launched, and I'm going to be sending out to everybody in CARF's membership and our patient base. It's a survey on COVID vaccination. We feel that it's extremely important based upon this being the only patient organization for patients with scarring alopecia in the world to gather as much data about timely topics as possible. And one of these is a response to our webinar that we had in February about the COVID vaccination. Now that we have a massive rollout in the world with this vaccination, it's important for us to know what have been the responses from our patients to the different vaccinations, the different, the first dose, the second dose, where you're at in your journey with your hair loss. Has it affected it, not affected it? Have we seen changes? All of that information is really timely and really informative for our investigators to understand. So that survey will be going out probably in the next day or two after I get final approval from our medical and scientific advisory team. And then finally, our next webinar is scheduled for June. Again, we don't know the date, but we do know the topic, and it is going to be on mental health and wellness. This is something that we can all benefit from. So that is going to be in June. You'll be seeing an email and announcements once we have solidified the program, the speakers, and the date, but you will be informed accordingly. And we hope you'll be able to join us because, again, there's so much to gain from being a part of this unique community and this special condition. So we're here to serve you, and we hope you enjoyed tonight's webinar. Thank you very, very much. I hope you have a great spring, and we'll see you again in June. Bye-bye, everyone.